We definitely have to touch to a personal experience.
Yes.
So anal fissures and hemorrhoids.
Yeah.
Layman's terms again, if you're to describe these two, how would you describe them to a layman's?
Actually, there are three things which affects an anus: fissure, fistulas, and hemorrhoids. All three comes because of constipation. So a fissure is a cut at your anus, which happens because of hard stools, and that cut typically gives a lot of pain and minimal bleeding. Fistula is an abnormal communication between your anus and the external skin. So it creates a small tract between these two things, and it gives you pus discharge around your anus. And hemorrhoids are the dilated or maybe swollen blood vessels inside your anus, which typically gives you bleeding but minimal pain. So these are the three things: more pain, less bleeding, it's a fissure; more bleeding, less pain, it's an hemorrhoid; and pus, it's usually a fistula. But basic cause for all these three things is our lifestyle and constipation. So if you don't drink enough water, if you don't eat enough fibers, and if you're not active enough, if you have sedentary lifestyles, you may get these things. There are some other medical conditions also, like for constipations, like if you have thyroid issue, diabetes issue, some electrolyte abnormalities, you can still get constipation. But the most common causes is our diet and lifestyle.
Are there chances that that can just happen naturally, or like maybe genetics, or
see, there is no evidence that it's genetic. Okay. But why you see more common in a families, usually families will eat same diet. So when you guys are eating same things, more people in a family can get the same things. Exactly, it's not a genetic thing.
When is surgery necessary for just the fissure, fistula, and hemorrhoids?
So fissure and hemorrhoids, they can always be treated with diet and medicines as well. So we usually start with dietary changes: drink more water, eat more fibers, all these things. There are medications to treat fissure and hemorrhoids. When the medications also fail for approximately if you have tried medicines for 4 to 6 weeks and still not helping at all, in case of fissure, the pain is excruciating that you can't even tolerate to sit. Those cases, you obviously need to go for surgery. That's the thing. For fistula, surgery is almost always needed because it's a tract. It's an anatomical defect which doesn't close by itself with any medication. So fistula, almost always you need a surgery. Fissure and hemorrhoids, we do it when medical management fails.